Hey fam, good evening everyone. Good evening, good evening, good evening. Mm. Sweetheart, welcome, Vivian. Welcome, welcome, welcome. Hey people, welcome, welcome, welcome. Tonight is learning night. Oh, I came with my notepad and biro. Good evening, welcome, Bumi, welcome, Gogo, Belicious, Psych Essentials, welcome, Ogene Ubukome. I hope I got that. Vivi Love, welcome. Jora Naturals, welcome, 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 welcome. Thank you so much for being a part of this tonight. Thank you, thank you, thank you. We are just getting started. We want to talk about, hey, I see Dr. Emi's around already. We want to talk about the HPV vaccine. So for those of us with younger girls, we are just learning about the HPV vaccine. We're just learning about, like, I just got to know about it like early in the year. So you can imagine I've not had older girls that I needed to do this with. So I'm just learning. And for me, I don't like sentimental decision making. I don't like herd mentality when we need to make decisions, all right? Sweetheart, help me with that. I don't like herd mentality. Someone said, someone said, someone said. So I like it to be factual. I like it to be pro conversation. I like argument where this one says no. Have you thought about this? Have you thought about this? All right. So I see Adewumi saying I took it during Canada. Fantastic. So we want to make informed decisions. We don't want to be a community of hearsay parents. So today I'm bringing in one of the very amazing doctors that I know. Dr. Emmy, I'm going to be looking for you now so that I can bring you in. I saw somebody say Dr. Emmy is a pediatrician. She's actually one of my children's doctors. We have the privilege to have phenomenal, thoughtful doctors like Dr. Emmy. And hey, Doc.
Hi, Irene. Thank you so much. Thank you so much
Oh,
for this.
this
I'm so happy to be here.
Yes, thank you so much, Doctor. You're welcome. So I wanted us to hit the ground running as quickly as possible. It's so
Okay.
good to see you outside of the hospital.
You can see that
Honestly,
again.
thank you so much for what you are already doing online here,
Thank
and
you.
the privilege for us to have this conversation with you. I was just telling the parents that we want to be an informed community, not sentiment,
Yes.
not hearsay, not we
Yes.
don't want to import frustration. You know how we don't have enough information, and so we
Yes.
make decisions based on shallow knowledge. So tonight
Yes.
is a learning night for all of us, and the ground is
Yes.
also open for parents who are watching with us, who are maybe doctors
Yes.
whose daughters have taken it before. Both those that are
Yes.
for and those that are against are welcome to share their thoughts.
Of
And
course.
so we're ready to get started. So, Doctor, would you start by introducing yourself to us
Okay.
and your specialty and your interest in this topic?
Okay. Good evening, everybody. Thank you for joining us here. Thank you for taking our time to join us in this conversation. My name is Dr. Enemi Isichei. I'm a pediatrician. I work with Further Medical Center. I've been practicing pediatrics for over 10 years now, and I have a passion for pediatrics. Basically, like I sleep, wake up, everything about me is pediatrics, and um, especially with this, when I first of all saw this HPV advertisement with UNICEF when they talked about it, and I was excited because Nigeria is way behind, so if anything that will be for the benefit of children, for girls, I'm all in for it.
Okay.
So that's why I'm here today.
All right, ma'am. Thank you so very much. So today I want to start out, I would like us to start out talking about, there's been a lot of concerns about vaccines in the world over. Can we touch a little bit about some of the key conversations for and against vaccines generally? And then from a medical point of view, help us see, for the people that are against, what do you think their concerns are? And maybe very briefly just address a few of them. Not HPV now, but the entire culture around vaccines.
Okay, so basically, vaccines have been on way back, right?
Yes.
Since in the early 90s, right? And you know, some people feel like when they take a vaccination, they probably have a side effect. Yes, we have vaccine associated adverse reaction, but then there are some people that there are some people that have specific genes that when they take a particular vaccine they would react. Not everybody, but
Yes.
vaccines are safe. So when you want to weigh the pros and the cons, the benefits as against the side effects or against the danger, we say prevention is better than
Yes.
cure. So the benefit of vaccine cannot be overemphasized. So for example, when polio, right, when polio vaccine started, but even tetanus vaccine, most people didn't want to take. Let me even go to tetanus. Most people didn't want to take tetanus vaccine because they felt there was no need. But then we now started having cases of women giving birth, not taking the, because if you know when you're pregnant, they even give you tetanus immunization, which
Yes.
is the vaccine, not taking the vaccine, and then you have newborns coming down with seizures, coming down with convulsions, right?
Yes.
So it was included into the expanded program of immunization. We have that. And then we also have measles, mumps, rubella vaccine that
Yes.
people didn't want to take it because they felt, oh, if I take it, I'm going to start convulsing or something. But now everything is all inclusive, right? Because if you look at the side effects of everything has side effects. Maybe you have pain. Okay, like even pentavalent vaccine, when it started, people were like, oh, my child is having fever. Once I give the vaccine, all the 5 vaccines at once, my child will start having fever and crying and all of that. But then you're seeing that the pentavalent has hepatitis B vaccine that does not only protect against hepatitis infection, but hepatitis infection can also progress to cause hepatocellular carcinoma. So you're not just even using it to kill one bird, you're using it to kill 2 birds at the same time.
Yes.
So basically, I would say that knowledge is key. When people are able to understand the benefit, there's some people say, okay, and why they bring it to Africa? Like even when COVID vaccine came out, they say, oh, what, they don't want to kill us, no. So that's why these conversations have to be done so that people will understand the benefits, people will understand the possible side effects and make informed decisions.
Okay, so if I heard you correctly, what you're saying is with every vaccine, there are histories of resistance where people say, oh, it causes
Yes,
maybe fever.
yes,
So you are trying to
yes,
say that,
yes.
well, it may cause fever. You're saying that it may cause fever at the instance of taking the vaccine. But what about long-term benefits?
Yes,
Am
yes,
I correct?
yes,
So what
yes, you're
about long-term?
correct.
So you're saying that in as much as there are those concerns about some people's genes reacting to vaccine, it's still
Yes,
important for us to ask ourselves, does the benefit outweigh the risk?
very correct.
All right. So tell us about the history HPV vaccine. Why are we taking it? What is it
Okay,
preventing?
okay,
What would we miss if we didn't take it? Yeah.
okay. So now, HPV vaccine, what's the vaccine about, right? It's a vaccine against human papilloma virus. Now,
Yes.
this virus is a DNA virus, and the virus is ubiquitous, meaning it is everywhere. It's 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 it can infect both living and non-living things. Now, this virus can they call it a steady virus, meaning that it is resistant to heat, it is resistant to drying, it can stay on surfaces, it can stay on fomites, it can stay on sheets for days, right? And this HP virus has about 100 strains, more than 100 different strains. So to break it down, just like we say milk, you have pig milk, nan milk, different kinds of milk. So it has more than 100 strains of HPV virus.
Yes.
And then at least 14 of them cause cancer. Now, for these strains, you have the low risk strain and the high risk strain. The low risk strain will cause genital warts, which is like type 6 and 11. They don't cause cancer. But the high risk strain, you have 16, 18, 33, and all. There are a lot of them, and they cause cancer. Now, 70% of the high risk strain would cause cervical cancer. So the high risk strain will cause 70% of the high risk strain will cause cervical cancer, 70%. And then the remaining percent will now cause vaginal cancer, oropharyngeal cancer, penile cancer, vulvar cancer, laryngeal cancer. So we're taking the vaccine because this virus is everywhere, and it can. And then the thing is, when someone gets infected with human papilloma virus, the virus usually, when someone gets infected, the virus remains dormant. So because it's a virus, you know, when your child has catarrh, you say it's a viral infection, it will go on its own. So because it's a virus, the body has a way of trying to eliminate it. So sometimes the body will eliminate it, so you will not even know that you've been infected, and the body just eliminates and the person is fine. But most times, some other times, the body will not be able to eliminate it because the virus remains dormant, stays there. Then after, for people that have a normal immune system, people that are not ill, people that are healthy, so after 15 to 20 years, if they've been infected with a high-risk strain, 15 to 20 years later, these people will now come down with cancer. If it's people that are immunocompromised, people that maybe have HIV or diabetes that are immunocompromised, about 5 to 10 years later, they will come down with cancer. So because the time between infection and the manifestation of the disease from the high-risk strain is so wide, you can't really say. That's the reason why we need to be vaccinated. Now, the question is, okay, like we had people, like the conversations are, okay, what's the root of infection, right? It's transmitted through skin-to-skin contact and skin-to-mucosal contact. So basically, skin-to-skin contact, basically through sex, but not just sexual intercourse, because you are talking of skin-to-mucosal contact. So it's transmitted through the genitals, through the mouth, through the throat, and through the anus, right? And it's transmitted through, like I said, the virus is ubiquitous. So it's transmitted even through fomites, through maybe people that use sex toy and all of that. It's transmitted through that. Now, the question is, are we doing this vaccination because we haven't given our young girls? Are we doing it because we're trying to promote sexual promiscuity? No. Now, the cervical cancer, 99% of cervical cancer is caused by human papilloma virus. And the risk factors, the primary prevention for cervical cancer, so when we talk about prevention of diseases, right, we want to talk about the first primary prevention. So eliminating disease before it even occurs is the primary prevention. The first thing there is human papilloma virus vaccination. So we're giving girls 9 to 14 years of age. Why do we have to give these girls? Now, girls this age, 9 to 14 years of age, it's been proven that the vaccine is more effective in eliminating the virus even before there is an exposure. What do I mean by that? If we remember back in school, like our biology, or they tell you antigen is a foreign body, and the antibody, antigen is a foreign organism. So when there's an antigen, your body will not produce antibody, something to attack it, right? Yes. So that's what happens. So people say, the virus is, if you take the vaccine, you're going to get human papilloma virus as like it now, you will now get the infection and all. I'm here to debunk that myth that it is not true, because the vaccine is made up of proteins of the virus, not the DNA. Because I started saying that it's a DNA virus. Now, you know, when we say, this thing is in my DNA, it means it's in my blood, you know, so it's not a live virus. So the vaccine is from the proteins of the virus. So when someone is vaccinated, because it's a protein and it's an antigen, the body will now mount an immune response and create antibodies. So the vaccine is more effective in creating antibodies against the virus before there is an exposure with the virus that has the DNA. So girls 9 to 14 years of age are not likely to be sexually active. So they are protected already. So when you give them the vaccine, they are able to produce more antibodies against the virus, which is why we are vaccinating this age group. The second line of prevention for cervical cancer is tobacco, right? So it's been shown that tobacco exposure can lead to cervical cancer. So the counsel is, of course, when we talk about tobacco, people can be passive or active smokers, in the sense that you're in a room where people are smoking, you're a passive smoker, smoking is a risk factor for cervical cancer. And so that's one of the risk factors. The third thing we advocate is sex education, which I'm so excited doing this with you, because you're someone that propagates sexual purity. Now, for sex education, as clinicians, we say sex education should be as easy as ABC, right? Which means that A is abstinence. We tell young girls, like, abstain from sexual intercourse before you get married, right? So abstinence, so that you're not thinking of any STI or pregnancy or anything, right? So A is abstinence, B is be faithful, and then that's if someone is having sexual intercourse, the person has to have one partner, and then C is to use a condom, because that's a risk of transmission. But then the vaccine, I believe me, I can keep talking and talking and talking. So
No,
let
I'm
me slow down
enjoying
if
you.
it's
Yeah,
too
I'm
slow.
enjoying you.
Okay.
Yes, I'm learning
So
quite.
okay,
Yes.
okay. So that's where the vaccine comes in. So we're giving 9 to 14 years of age. So that's like the primary prevention against cervical cancer, because I earlier said that 99% of cervical cancer is caused by human papillomavirus. And then, one of the things that made them to bring the vaccine to Nigeria now is because um, in 2020, WHO had a strategy, right? There was a strategy with a goal that by 2030, the incidence of cervical cancer will reduce. Mind you, the statistics say that as at 2020, 604,000 women around the world were diagnosed of cervical cancer. And then from 604, another statistics raised that 342,000 died of cervical cancer. And cervical cancer is the fourth most common cancer among women in the world. So the first most common cancer among women in the world is breast cancer, and then you have lung cancer, colon cancer, and then cervical cancer. That's globally. Well, let's bring it home to Nigeria. Cervical cancer is the second after breast cancer in Nigeria, right? And so from the statistics for last year, from statistics of last year, cervical cancer, we had about 12,000 women diagnosed of cervical cancer as at last year. And then we had
In Nigeria.
7,900 women. Yes. So I'm going to send you all the pages. So I'm talking from human
Okay,
papilloma
graphics, yes.
page. Yes, I'm going to send you all the links, right? I have them. So in Nigeria, I wrote it out here. So in Nigeria, we have 12,075 women last year diagnosed of cervical cancer. And then we have 7,968 women dying of cervical cancer. That is here in Nigeria.
And
So,
this is all
so even
prevented.
when, yes. So even when WHO had that goal as a 2020, that the goal was, they called it the 90-70-90 strategy, meaning that by 2020, 90% of girls less than 15 years would have received HPV vaccination. 70% of women that are 35 years would have done their first cervical cancer screening, and then by 45 years would have done their second cervical cancer screening. And then 90% of women who are diagnosed of cervical cancer would have started treatment. Now, after that discussion they had, that was 2020. By 2021, the percentage of people around the world that had received HPV vaccine reduced from 25% to 15%, because of course there was COVID. So a lot of people were at home and all of that. So it reduced. And then they now had more cases of people coming down with cervical cancer. Mind you, cervical cancer they call it a slow killer. So someone is an adult, like later in life, like an adult, you now find out that persons start having vaginal discharge, foul smells, vaginal discharge, vaginal bleeding, leg swelling, and then that's if the person is not being screened. Before the person knows, goes for investigation test and finds out that the person has cancer, right? So that is why it is imperative that people take the vaccine, and then older people start getting screened for cervical cancer. Because if it is caught early, it can be, if it's at the precancerous stage, it can be treated, right? Not when it gets to the the advanced stage. So that's why all of this came into place. And then why are they bringing it to Nigeria? We are way, way behind, like way, way behind. You won't believe that Rwanda started HPV vaccination in 2011. Uganda started in 2015. I'm talking of African countries. South Africa, 2014. Zambia, 2013. Tanzania, Mauritius, Seychelles, Kenya, Ethiopia, they've all started the vaccination. So HPV vaccine was introduced in 2006 in America. Then in 2007, Australia was the first country to add HPV vaccination into the immunization scheme, right? So it's been on since 2006 till now. Like that's like um
17 years.
yes, for 17 years, right? So it's been on for 17 years. And the goal, so cervical cancer is, with the vaccination, is a preventable disease. So the goal of the World Health Organization is that by 2020, right now, statistics says that every 2 minutes, one woman dies of cervical cancer. Every 2 minutes in the world, one woman dies of cervical cancer. So the goal is that by 2030, the incidence or prevalence of cervical cancer will be 4 in 100,000 or less. So that's why. And the vaccines are not even cheap. One vaccine. So girls, so I was talking to the primary health center scheme, and I was asking, okay, so what's going to happen for girls that are age 15 and above? So it's free for girls 9 to 14 years, right? But girls 15 and above will have to pay. And one vaccine in public hospitals from straight from the primary health center, one dose is 60,000 naira, just a shot. So if the government hospitals are going to be giving it for 60,000, then I don't know how much private hospitals are going to be giving it. Let me pause. Because if you leave me, I can keep telling you a whole. Yes. So it. Okay, go ahead.
I actually have two questions. The very first thing I'm noticing is that HPV is not a new conversation.
Yeah.
It's always been there. We're actually having this conversation too late. But I wanted to ask, has there ever been any report of a person who took the vaccine but still came down with cervical cancer? Is there data that shows the number of people and how different their reality was from people who did not take it at all? Do we have any data like that?
No. I don't. I didn't see any data on that. But the data that is available is that so the HPV, right? The HPV vaccine protects. So there are different types of vaccine. Remember, I said there are about 14 strains of the high risk, right? So there are 14. There are 14 strains. There are 14 strains that can cause cancer. But the 16 and 18, 7 most commonly cause cervical cancer. But you still have other strains that can still cause different kinds of cancers, either penile or oropharyngeal. But the vast people that from the statistics that I saw, and like basically most of the things I was looking at for was WHO, because that's the gold standard, right? Yes. So there was no information about anybody taking the vaccine and getting cancer. Now, taking the vaccine doesn't mean no. But what was there was that because so there are 3 types of vaccines. There's the bivalent, right? The one that only has 16, protects against 16 and 18 only, right? Then there's the quadrivalent, the one that has 611. 611 is the one, 6 and 11 are the ones that will cause genital warts. They are the low risk. Then 16, 18 are the ones that will cause cervical cancer, which of course cause 70%. So you have the quadrivalent, right? Then there's the nonavalent, which is available only in America. The nonavalent has 16, 18, 6, 11, and 5 other, and 31, 33, 45, 52, 58, because remember that there are about 14 strains, right? Yes. So it protects more. Yeah, it protects more. So what's available is that people take the vaccination, the risk of getting cervical cancer is greatly reduced, right? But as people get older, when you get to like 35, it's imperative for you to do
screenings.
Your screening, yes, to do screening. But the chances of you getting it is having cancer is
negligible. Okay, so I wanted to ask, which of the strain is being advertised in this promotion? Is it the quadrivalent? I know you said the nonavalent.
The quadrivalent.
The US. So which one are we being asked to give to the girls now? Is the quadrivalent that prevents against high risk strain?
Yes, high risk and low risk, 16, 18, 6, and 11. That's the one that, that's the one that we are getting. Yes.
I'm getting a crash class in MBBS right now. All the terminologies so let me see what questions are out there. So since one of the biggest challenges is that there's somehow a distrust. There's a distrust in our society today. So I want to look at questions that are being asked. A particular parent said, why would I take a vaccine that I would have to start checking if the cons outweigh the pros? If it is uncertain, then why should we get it? No, that's not what we meant. So for example, I'm going to talk from a mother's point of view, and I'm also going to allow Dr. Isichei talk from her own point of view. For example, when you go to take that first vaccine when the child is about 6 days old, there's always a thing about having paracetamol to calm them down because they may run a temperature. So when we say when I was talking about pros and cons, I wasn't talking about would they lose their ear so that they don't have cancer. I just meant that initial reaction, that initial, whether they ran a fever and all of that. So, Mama, I don't know if Dr. Isichei has anything to add. We didn't mean something like, so my understanding is not that there will be, meanwhile, let me just ask, let me not make any assumptions. Dr. Isichei, is anyone taking this vaccine and they're coming down with, you said it at the beginning that some people's DNA reacts to certain things. Can you give us the percentage, the ratio of this incident? And what kind of things are they coming up with?
Okay, so now, the side effects, right? The side effects of the vaccine, right? So 1 in 60 people would have fever. 1 in 60 would have fever. Yes, 1 in 60. Yeah. That's from statistics. Then, of course, there can be discomfort, like pain around the site of vaccination. Then there can be redness, there can be headache, there can be muscle and joint pain, and then there can be like weakness, like fainting. So it's advised that when girls take the vaccine, they sit down for about 15 minutes before they stand up. Mind you, it's not only HPV that causes fainting when you take a vaccine, like weakness. Meningococcal vaccination too can cause syncope, and then even Tdap, that's the booster dose of DPT, it can cause fainting. So usually it's advised that people, what's it called? People, the girls sit down for 15 minutes and then before they stand up. Right. Then, I don't know if I should go above, but if you check online, right, the people are saying the other side, the people, like, you know, when you raise the conversation on your page that day, some people say, oh, there are lawsuits against the vaccine, against the side effects and all of that. And it got me worried because I'm like, I really need to check, I really need to read. And in fact, I have to call someone. What's happening out there. Yes, I have to call someone that works with UN to ask questions. Like I have to, so the person told me, go and read WHO. Just go to WHO site, read everything. And I went online and I started digging, right? So, so in America, if you check online, you see about, you know, different lawsuits against Gardasil. Like that's one of the quadrivalent brands, right? Gardasil. Some people say it's causing postural orthostatic tachycardia, meaning when you try to stand up, you have to start beating fast or something like that. But WHO, as at last year, 16th of December 2022, WHO brought out, it's online, I'll send it to you, all the links. WHO brought out a paper that states WHO's position with regards to HPV vaccination. And in that paper, it was stated that Gardasil it does not cause any side effects, like, because, you know, before these vaccines, in fact, before vaccines are usually brought out, they usually do a control study. They usually have like a group of people, right, and they test it on to make sure that everything is like side effects at all. About, when I checked online, about 15,000, 25,000 people, like they have to check, you know, practice it and be sure that it's like studies. They had like control studies, randomized control studies to be sure that, you know, it can go out to the general public. So Gardasil in WHO's paper, it was stated that Gardasil does not cause any of those side effects. Any side effect that it was saying. Yes. And then I went on again, I kept reading, I kept checking. And then some papers also went out to say that there are lawsuits against Gardasil in America, but there has none of those lawsuits have gone to trial. Why? None of those lawsuits have gone to trial.
Two. Are you there, or is it my screen that is frozen? Can you hear me?
You're frozen. I'm here. Yes, okay. Very well.
So this is my,
yes, is your screen. Right. So none of those cases have gone to trial. Then remember, and Gardasil has not been banned in any country. Gardasil is still being used in America. Remember that Gardasil is the one that has the 9 non-valence that protects 9 and the quadrivalent, right? So Gardasil is still being used in America. Yes. And then I went on to check. In 2013, Japan banned HPV vaccination because that's when all these lawsuits started in America. So Japan banned HPV vaccination. But this year, 2023, Japan has recommenced HPV vaccination because of the increasing rate of cervical cancer in that country.
Okay. So can you hear me?
Yes, I can hear you.
So Japan banned the use of the vaccine, because there was an increasing rate of cervical cancer.
No.
So how have they been able to resolve?
No. You're getting me wrong. In 2013, Japan banned all the vaccines HPV because of, different talks about, because of lawsuits in America, different talks, all of them. Yes. But in 2023, they recommenced the vaccination because they were now having an increasing rates of cervical cancer.
Number, which can be connected to the fact that when they are vaccinated, they are lower incidence.
So the vaccine protects against HPV 90%, against cervical cancer 90%. Yes, is right. Yes, 90% protective against cervical cancer.
All right, thank you so much. So, doctor, I'm looking at So here's okay. So somebody wrote this question: who produces these vaccines, and what is their mission with the vaccines? Do doctors produce medicine? How do you know the vaccines are safe? Do doctors test the vaccines, or just recommend what they've been told to recommend? So before Dr. Isichei answers this, let me give you my attempt of the interpretation.
Please do.
So, by the way, like I said earlier, I'm not asking anyone to go and vaccinate their daughters or not. I just wanted us to have conversation where we are better informed. So this is what really happens. The biggest part of medicine, as I know, is research and data. As people come to the hospital for treatment, there's a lot of documentation. So for example, it's easy. Medicine should be actually the easiest place to throw out data, because if you go to FMC, from basically the laboratory test and results, you can see when there are high incidents of a particular kind. And so when medical research is done, people propose that, they propose different things and then they test these things. There is no way a single doctor in Federal Medical Center can get up and say, I want to test if these vaccines work. They have to trust the system. They have to trust that, there's been this rigorous testing. And one of the things I knew over the years is that before anything, especially vaccine or a medical intervention, comes into the mainstream, they would have tested it with a number of people over a long period of time to eliminate some incidents, like data. So this question about whether they can test it, I don't think doctors have the facility to test. But they have like for instance, World Health Organization, that they have to rely on the data they bring. And then as doctors start to implement some of those solutions, they're also seeing how patients are faring. Dr. Isichei, am I correct? Because I don't expect you to run a test on whether or not.
Yes, you're correct. Very correct.
Yes, so they have to, they also, Dr. Isichei, for instance, they're one of us. They have to be a part of an organized system. If everybody started doing tests to verify whether something was good or not, and there was not a benchmark, there's going to be abuse. So there's going to be abuse. But doctor, we still need to grapple with the fact that after COVID, the world has a problem trusting from WHO to big pharma. That's part of the problem. COVID allowed us to sit down and see there was a whole lot of things. Meanwhile, I'm aware that there are things that we believed from COVID that were not documented, not probably researched. Opinions were passed as professional data. So that, but now we are now at the receiving end because there's distrust. And people that have this distrust are standing on things, materials they came across, people that spoke persuasively on certain regards. So I'm looking at Sister Normal again. She's asking, according to research, most diseases like breast cancer, fibroids, and barrenness are caused by vaccines taken when these ladies were young. Wow. That statement you made is overwhelming.
Does she have statistics? Does she have papers?
Can you send us a link to this research? A research that shows this. Do you get it?
Yes.
So one of the things I want us as a community, because if we're raising girls, the girls are going to be the mothers of the next generation.
Yes.
I want us to start vetting it. All right. If they have antibodies, why inject them with the virus for them to produce more antibodies?
They don't have.
So I think
antibodies. They don't have antibodies. Do I need to explain again?
Please do that. Please do that. So because maybe she misunderstood that if we already have antibodies, why are you injecting us with more antibodies? Please explain that. Thank you.
Okay, you know, like if you remember back in your biology in school, when you talk about antibodies and antigens, right? So so when there is a foreign body, right? Your body, the first foreign thing is called an antigen. Then your body now starts trying to fight that foreign thing. So your body will now produce antibody against that thing to fight it and kill it, right? Now, after it does that, there's something called memory T cells, right? So part of the antibodies that your body will now form is what we call memory T cells. Memory means to remember, so that anytime that part against your body, because your body has created antibody against it, it will remember, and that thing won't have a chance to stay.
Oh.
Do you understand? Do you understand?
So if I hear you correctly, what you're saying is that when we... Yes, can you hear me?
Yes, I can.
Can you hear me, ma'am?
Yes, I can. Loud and clear.
So if I heard you correctly, what you're saying is that when we take vaccines produce antibodies against possible infections in the future.
Yes.
And so when there's a threat,
yes.
those antibodies
Yes.
that were already equipped to deal with it
Yes.
now come into.
Yes. Yes.
So we have another question here we need to quickly move to. So we have another question here, very important question, very important for me as well. She says, how will it affect fertility in the future? Can you actually assure mothers that this vaccine will not have side effects like fibroids or infertility, which seems to be rampant now more than ever in the history of Nigerian women? So, Dr. Isichei, this is a two-in-one question. I know you're in pediatrics, not OB/GYN, for example. So, but I would like to hear what you think about this vaccine in relationship with fertility issues, but also, can we relate fibroids and infertility to vaccines? What's the medical data coming out?
No.
Can we relate fibroids and
No.
infertility
No.
to
No. You can't. You can't. You can't relate. You can't relate fibroid. You can relate fibroid to cause infertility, but you can't relate fibroid being caused by vaccines, right? Remember that. So let me tell you, when I was in medical school, let me just give you like a joke. One of my lecturers would say, bad girls get pregnancy, good girls get fibroids. Do you understand? Meaning that it's fibroid is common in the blacks. Fibroid is common in black women that are nulliparous, that have never given birth before, because your uterus begins, the cells just begins to grow because the uterus is not active, right? So it's common in people. It was initially found amongst nuns. If you check the history, among nuns, so that was where fibroid was initially discovered, among nuns. So it is not related to vaccination. It's related to genes, like we are black people. It's related to nulliparity, right? Those are the things that are related to fibroid. Now, let me answer the question of infertility with HPV. This is one of the myths that I said I was going to debunk today. So yes, people are saying, oh, it will cause infertility. But it is the other way around. Not taking the vaccine can predispose to infertility. How? Because when someone gets infected with a virus and comes down with cervical cancer, the person would have to undergo chemotherapy or radiotherapy, or right? And those drugs and chemotherapy, it's like they are toxic, so you can't take chemotherapy drugs, because the chemotherapy drug is supposed to kill the cancer cells, and even sometimes even kills the normal cells, right? So people on chemotherapy are not allowed to get pregnant, because even if they get pregnant, it will affect the baby. And then radiotherapy too can also affect. And sometimes, depending on the stage of that cancer, the person will have to undergo a hysterectomy, which is removing the uterus. Yes, somebody is saying fibroid is caused by our food, red meat, oil, chicken, and all of that. Those are even most of the cancers, right? So not taking HPV can predispose you to getting cervical cancer that will now lead you to having a hysterectomy later in life, like removing the womb, because you don't want it to spread. So depending on when they find it, they'll just remove it so that the thing doesn't spread. Not taking the vaccine can predispose the person to cervical cancer, of which chemotherapy will have to be done, and the person that can cause infertility. So it's the other way around.
Okay, so you're
saying
that is the other way around. That
it's the other way around.
Fertility can become an outfall of having cervical cancer, whereas HPV is there to actually prevent cervical cancer. Fantastic. Nepa has struck. If my face looks darker, let's manage it. That's a third world problem. Fantastic. So somebody is asking what are the side effects of the vaccine. I know you listed it before, but I would like you to go over it again. But one more minute before we go. Someone asked, is this HPV? The answer is no.
Irene, please, can you come again? I didn't hear that question.
So someone asked the question that is this HPV given to babies? And so we said that I'm answering on your behalf. Is it given? Can it be given to babies?
No.
No, From 9 years
and
not
above.
at all.
Yes.
From 9 years and above. So, doctor, do you want to? Somebody is asking, what is the statistics of those people that this vaccine has cured of HPV? Please let me answer this one before you answer. So, vaccines don't cure anything. Vaccines prevent the occurrence of a disease. So how they are measuring it is saying, are the numbers of cervical cancer cases reducing as more people are taking HPV vaccine? That's how they're measuring it. So the more people take HPV vaccine, the lesser number of women coming down with cervical cancer over the years. That's why they said when Japan pulled out HPV vaccine in response to all the lawsuits, what they saw was an increase in the cases of cervical cancer. So the vaccine does not cure HPV. The vaccine does not cure HPV. It does not cure cervical cancer. The vaccine prevents it from occurring at all. But doctor, I hear somebody asking, how many shots will the girls need? The girls 9 to 14.
Okay, one shot. Because previously they used to give 2 shots, but recently it's been proven that 1 shot alone is enough to protect. So it's only just 1 shot that the girls are receiving. And just to add to what you said, so the vaccine is only from 9 to 26 years, right? And even after 26 years, they don't advise you to take it because after 26 years, the possibility that the person will be sexually active is high. So you have to consult your gynecologist that you're not sexually active, you're okay, then before they can give you. Because like I said earlier, the vaccine is more effective in protecting before there's an exposure. Yes.
Okay. So like I mentioned earlier, I see you, Credible Honey, because this is the problem. This is just the challenge we're having out there post-COVID. There's a distrust in the system. So Credible Honey was saying, how are these statistics derived? I keep hearing statistics, this and that. I remember that COVID, every disease was recorded as COVID in the hospitals. Even accident victims were recorded as COVID. So how do we trust these statistics? So, sweetheart, I understand your distrust. I understand your distrust, but here's the thing. We're asking ourselves the real question. What is it helping prevent? So, for example, let me just tell you what I think in my personal opinion, all right? This is my personal opinion. I'm not saying it for you to go with it. I've sat down and asked myself, number one, what would this thing prevent for my daughters in the future? And I want to prevent the occurrence of cervical cancer, definitely. But I've also taken a spiritual stance to say, look, because of that, the idea that some people may have a DNA strain that could lead to a reaction, I've taken authority already that my children will not have any reaction to it, that nothing negative will come out of it. I love the idea of preventing these kinds of diseases, but I'm also taking authority and saying, I mean, I can say this any day. I have a family planning method I've been on, and when I come online and hear what people are saying, my God. One time I was just on somebody's page and I was reading it. And the next thing I just heard the Holy Spirit say, you're going to speak for yourself that you're not going to have those reactions. I mean, there's becoming overweight problem. I can't even say the family planning method is the reason I've added weight, because I mean, I've been on it for so long. Even if they had to do some research to measure my weight disparity every time I went for those clinics, I won't be able to really pin down that. But we have somebody in the comment that likes this. So somebody is thanking the government. President's mom. Doctor, I'm sure you want to hear that one. She said, I wanted to give my daughter HPV since she turned 9. But it was not only expensive, but most government hospitals didn't have it. I am so glad this is coming now. Now she's 14 years old. Thank you. So you have been trying to do this for 5 years. Fantastic. So, doctor, any idea when we are going to get the nonavalent
No.
vaccine?
Like getting the quadrivalent, that's the one that has 4. Nonavalent is only in America. So we're getting the quadrivalent, the one that put that, 16, 18, 6, 11. It's starting, actually, it's even starting earlier, next week, Tuesday, on the 24th of October.
On what states?
So,
tell us the
okay,
states.
yes, Abia State, Adamawa State, Akwa Ibom, Bayelsa, Benue, Bauchi, Enugu, here in Abuja, that's FCT, Jigawa, Kebbi, Kano, Lagos, Nasarawa, Ogun State, Osun State, and Taraba. So it's starting with 16 states now, but by the first quarter of 2024, the remaining 21 states will get it. So the good thing is that initially they wanted to go to schools, but now they're going to be taking it to all the